Hello everyone. So today's topic is Ludwig's angina. So first try to understand what is Ludwig's angina and what is the space that involves in Ludwig's angina. So it's a form of cellulitis which is mainly involving the submandibular space. Now first question is what is submandibular space? So this complete bluish marked space is submandibular space which is being divided into two parts by the mylohyoid muscle. So the mylohyoid muscle is the muscle which divides this submandibular space into two halves. The above one known as sublingual and the lower one is submaxillary. So this is submaxillary space and above one this is sublingual space. So mylohyoid muscle is the muscle which divide this submandibular space into two spaces. So what is Ludwig's angina? Basically this is a cellulitis. It is a form of cellulitis or connective tissue disorder that is affecting the submandibular space and causing the local inflammation, trismus, tenderness over this submandibular space. That is the area below the tongue and the neck. So as you can see in this diagram, so this is our tongue. This complete is our tongue. So the area below the tongue in the neck is the submandibular area and cellulitis of this space is known as Ludwig's angina. I am repeating, this is not an abscess. Usually we get confused that Ludwig's angina is an abscess. No. According to the criteria mentioned for Ludwig's angina, it is an cellulitis of submandibular space. Now look at the picture clinically. So this is a patient with the Ludwig's angina where we can see the edema in the neck that is below the tongue in the submandibular area. Mainly here the space involved is submaxillary space. If we do the CT scan, this is the sagittal section in the CT scan where you can see the edema or the cellulitis. The cellulitis in the neck in the submaxillary space. So this is in CT scan showing the Ludwig's angina. So this is an infection of floor of the mouth, that is the submandibular space. Most common causes dental caries and the bacteria responsible are aerobic as well as anaerobic. That means the gram-negative and gram-positive organism may be present. Along with that, the anaerobic infection like the bacteroids will also be present. We have discussed the space is divided into two spaces by mylohyoid, that is sublingual and submaxillary. What are the clinical features? The patient will present with a tense swelling with a woody feel of skin of the neck. That it will be very tender, warm, very stiff. So patient will have that woody feel of the skin of the neck below the chin. Patient will have trismus, pain while opening the mouth and very tense swelling. So there is gold rings criteria to differentiate Ludwig's angina from neck abscesses. So firstly, this is a cellulitis and not abscess. It is generally always bilateral. That means both sides of submandibular space may be involved. It generally spread through tissue spaces, not by lymphatic. So it is not an carcinoma. It is not an infection or some space, infection or disease which can be spread by lymphatic. Generally it spread through tissue spaces, that is localized spread. Does not involve submandibular and sublingual salivary gland. Very important, we do the sonography, the patient presented with the Ludwig's angina. So usually there is only cellulitis, the infection or the edema occurs in the spaces, not in the salivary gland. So in the sonography, radiologist or the sonologist will mention that the submandibular or the sublingual salivary glands seems to be normal and only the space is occupied. How we have to manage? So we will start the antibiotics, medical treatment, analgesic pain for the pain relief, and then we will do the IND, that is incision and drainage. Why IND? There is no pus. IND is done to relieve the pressure, the tissue pressure, and this IND will also help in acceleration of healing process along with the support of the antibiotics. So this is the best treatment to treat Ludwig's angina. That's all. Thank you.